This is a short video about the impact that the Centre for Health and the Public Interest has had in 2023. Our year began with the publication of our research into the £2 billion contract between the NHS and the private hospital sector during the pandemic. It was covered exclusively by the British Medical Journal and will be submitted as key evidence to the COVID-19 public inquiry. In April, our research with Warwick Business School into the impact of COVID on the care home sector was covered on BBC News.
A study by the Warwick Business School and the Centre for Health and the Public Interest found nearly 2/3 of care homes went into the pandemic financially fragile. It says an extra £2.1 billion of government funding prevented the sector's collapse, but not all of that reached the front line. It points to limited change in staff pay despite their extra hours. The report also says more than 100 of the largest care companies increased the money they paid to shareholders.
It is pretty concerning that the money that went into the care home sector didn't in all cases go to the front line.
In June, we published research into the new public health system in England, raising serious questions about whether it is fit for purpose. This research was covered extensively in the Times. During 2023, we also continued to work with the media to emphasise the systemic patient safety risks in the private hospital sector and the ongoing impact of the Ian Paterson scandal. Throughout the year, we worked on this subject with the Sunday Times, The Observer, and with LBC Radio.
There still needs to be more regulation in private healthcare. David Rolls is Director of the Centre for Health and Public Interest. David, thank you for joining me this evening. The first question is the obvious one. This all happened in a private company. Do we need tighter regulation by the state of private healthcare in situations like this?
Thank you, Andrew. Absolutely. I think one of the major learning points from looking at the Paterson case, and we've looked at this over the past 5 or 6 years, is to realise that this isn't the first time that this has happened.
In October, we worked with BBC Newsnight on a major study into the impact of PFI on the NHS.
Investigation has revealed the extent to which rising inflation has hit public institutions with extra costs.
Newsnight, working with the independent Centre for Health and the Public Interest think tank, has been able to determine that inflation has added costs of almost £500 million to English hospital trusts over the past 2 years. That's equivalent to the salaries of some 7,500 newly qualified nurses. This is on top of the £2 billion they are repaying in ordinary PFI charges every year.
In some instances, the payments to PFI companies for some NHS trusts exceed the amount that they spend on drugs. And that was before these very large increases in inflation, which means that the high charges that are being levied on these trusts in order to pay for PFI are inevitably going to have an impact on other available resource for patient care, for paying for staff, for other things that they might want to do. We've also continued to provide specialist advice and data to journalists seeking to understand conflicts of interest in medicine as a result of the growth of for-profit healthcare in the UK and the fact that more and more NHS services are being provided by for-profit companies. Over the course of the year, we addressed many conferences and events in the UK, and we also co-sponsored major academic conferences in Spain and Greece. We also added to our team of people as we seek to grow and develop as an organisation, including adding 2 new trustees to our board, as well as appointing a new fundraising coordinator. In 2024, we're aiming to have even greater impact and to continue to push for the public interest in health and social care.